We all often hear about sleep apnea. It mostly resonates with snoring, tiredness, and sleepiness. But did we ever stop and think about what it means beyond symptoms? What is it? Sleep apnea is a sleep-breathing disorder characterized by pauses in breathing or periods of shallow breathing during sleep. Each pause can last for a few seconds to a few minutes and happens tens and even hundreds of times a night. When? While patients are asleep. Sleep apnea sneaks up during sleep, so patients are usually unaware of it. What they feel is dry mouth and headaches, excessive daytime sleepiness, impaired alertness and vision, and cognitive problems. What they do not feel is the damage the sleep apnea is causing their bodies. Who? 25% of adults worldwide suffer from sleep apnea. In Western countries, it is mostly associated with high BMI, obesity, and it's more prevalent with age. Here is a little-known fact. There are 85 million cardiology patients in the United States, and over half of them suffer from sleep apnea. However, 80% or more do not know they have sleep apnea. Even though it was published that treating sleep apnea reduces the risk for stroke and sudden cardiac death by 50%, reduces the reoccurrence of atrial fibrillation after treatment by 42%, lowers rehospitalization of patients after a heart attack, and improves resistance to hypertension, as well as reduces the risk for cardiovascular mortality by 20%, most of the patients remained undiagnosed. Why? Now, you may ask, why all of those patients are undiagnosed? Well, there are only 5,000 physicians with sleep specialty certification in the United States because until a few years ago, it's been seen as a quality of life, tiredness, and snoring type of disease, which didn't require a sense of urgency. In addition, the fact that the sleep world has prioritized in-lab polysomnography sleep testing with its limited availability, discomfort, and higher cost for both patients and healthcare system made diagnosing patients for sleep apnea a difficult-to-access procedure. In comparison, there are 33,000 cardiologists who manage roughly 85 million cardiac patients in the U.S. alone. These cardiologists, who are aware of the impact of sleep apnea on cardiac disease progression and outcome, traditionally have referred their patients to sleep doctors for diagnosis and therapy. But what happens when fast-paced and high-volume cardiologists face a long waiting list and high incomplete rates of sleep service? Guess what? Cardiologists eventually give up on referring patients and wait for the results. And the patients? Well, cardiac patients are so preoccupied with the seriousness of their disease, they have a hard time grasping the importance of treating their sleep disorder. Where? So wait. Those who actually make it to an in-lab PSG, what lab are we talking about? In traditional PSG testing, the patients need to go to a hospital or overnight sleep lab setting. They are fitted with chest and abdomen belts, a nasal cannula is placed in their nose, EMG, EEG, and ECG sensors are placed on their face, head, chest, and legs, and a camera is watching and recording their every move and, sorry, but this is what it really looks like. Patients are then told to sleep comfortably, as if they are sleeping at home, while technicians monitor them and go into the room to adjust the sensors throughout the night. Good luck with that. How? Now it's time to crack the case, since we have all the information we need. It wouldn't be fair to talk so much about the problem unless we had a solution to offer. ITAMAR Medical have launched a whole new approach to those millions of cardiology patients with sleep apnea through a combination of innovative home testing technology, change of point of care, and integration of health information. First, we need to take it seriously and catch our breath. To do that, we need to optimize diagnosing, provide a comfortable and affordable environment for patients, and link the results with treatment and report for cardiologists. In short, ITAMAR offers the total sleep solutions. Our state-of-the-art WatchPAT device creates the same quality test results for sleep apnea as traditional PSG testing, and within the comfort of your own home. The American Academy of Sleep Medicine, officially adopted PAT technology in its guidelines for the diagnosis of sleep apnea. PAT, which is short for peripheral arterial tonometry, is the technology ITAMAR uses for its WatchPAT devices. WatchPAT is like a smart watch with a simple finger probe. It's scalable, meaning no waiting periods, no sleep labs, no technicians needed to set it up on the patient. It's as easy to use as clicking a button. ITAMAR's Total Sleep Solutions provide a 4-step solution to both cardiologists and patients by combining diagnostics and therapy information. These 4 steps are screening, diagnosis, treatment, and reporting. ITAMAR's WatchPAT and the Total Sleep Solutions are a major helping force to sleep doctors and cardiologists in working together to improve patient care. Let's connect the dots. Connect with our breath. Connect with life. ITAMAR, world's leading sleep apnea solutions to the cardiology market.